Tonight, new vaccine guidance from LA County Public Health Director Barbara Ferrer in her first COVID briefing since the county's COVID emergency declaration ended last month. LA County now considers the bivalent dose the definitive protection against COVID-19, both as a primary dose for the unvaccinated or a booster for those previously jabbed. Dr. Ferrer is saying the target group is those 65 and older, only 42% of whom have received the bivalent shot. I asked Dr. Ferrer how she's planning to boost those numbers.
So our mobile vaccine teams, about 4 weeks ago, started really prioritizing places where older residents may already be. Our senior centers, senior housing, assisted living. And I want to emphasize, we will go to anybody's home to vaccinate them, because I think there's still confusion about that. It's 100% free. You just have to call us and we'll schedule a time.
Now, to date, just 17% of LA County residents 18 to 49 have received that bivalent shot. With more, we are joined by board-certified ER doctor, Dr. Michael Daignault, the Fox 11 medical correspondent, our contributor here. Thank you so much. We want to get your thoughts on what we learned from Barbara Ferrer today and the fact that the bivalent booster, as we've known it, is really now the only vaccine out there for COVID-19.
Right, so this follows a very important FDA regulatory meeting yesterday, and then the CDC follow-up today, which basically retires the monovalent vaccine. And this is the original vaccine that we had, which included just the original strain and did very well over the last few years as far as protecting everybody who was vaccinated from severe illness, hospitalization, and death. But what I think we're seeing now is we're trying to streamline the process so that when you go to get a vaccine, you're just going to get the bivalent vaccine, which, since it became available in the fall, it includes that original strain, but it also includes an Omicron strain. So, and as we've seen, it's been only Omicron for the last year and a quarter.
So what's the schedule in terms of when people should be getting shots?
So right now, I think everything, if you kind of read between the lines at the FDA meeting and the CDC meeting yesterday, it seems that they're setting us up for the fall, where it's going to be recommendations of one shot, an annual shot, along with the flu shot, for most Americans, and then the option for an additional shot, especially for those who are over 65 or at higher risk or immune compromised. It's just making it easier for pharmacists and doctors' offices that they just have one product, just the bivalent vaccine, to administer now.
The other topic that I touched on with Dr. Ferrer today is a photo of her that went viral over the Easter holiday weekend, in which she was seen at a grocery store without a mask, which we rarely see her, if ever, without a mask. I asked her about that, if she's surprised about the level of attention that such a photo brings. Here's her response.
I was there pretty early in the day. There were very few people. I felt comfortable. I mean, it was unfortunate I didn't have my mask. I usually do, but I didn't. At that moment, I didn't return to the car to find another one, and I felt very comfortable. It's a store that's actually very well ventilated, very big.
Very few people there, very few people in the room today. So, for the critics who say the mask hypocrisy, your response?
Yeah, I don't think it's mask hypocrisy, and I always have followed our guidance. Where it's required that we wear masks, I wear masks.
And that is true. There's no mask mandate in place, so she's fine to not wear a mask. It's just the idea that we don't see her often without a mask.
Yeah, and just basically a few of you in that room, right? So not a room that most
fewer than 10 people
would be wearing a mask.
Yeah.
All right, let's talk about another issue. Last week, you were on talking about mifepristone, which is this abortion pill. You talked about how relatively safe it is. I talked with the former Vice President of the United States, Mike Pence, about this yesterday. I know you have a lot to say about what he said. Here's what he told me.
20 years ago, the FDA exceeded its authority in approving the abortion pill. They actually used statutes that were designed for the emergency approvals. They didn't go through the ordinary processes, and women have paid the price. I fully support efforts to take the abortion pill off the market. I think I'm pro-life, but I also believe that it's caused great harm for women around the country.
Your reaction?
No, it's particularly shocking. I mean, we've had 30 years of robust, safe data around mifepristone, and the vice president to come out and say that it has caused years of harm to women. I mean, that's the false representation that the plaintiffs also used in the case in Texas, saying that it caused uterine contractions, vaginal bleeding. That is what the medical abortion pill is meant to do. And as I mentioned with you last week, I mean, less than 1% of women who take this pill end up in the emergency room of the hospital requiring management of the side effects, which are the bleeding and the abdominal pain and the nausea and vomiting. I mean, it has a very great safety record, better than most common medications that we use, including Tylenol and Viagra and other things. And so, you know, I find this, you know, really off base.
Well, the Supreme Court's decision is supposed to come down tomorrow night. I'm thinking about that tomorrow night by midnight, so we'll see. But they could delay again. But in any case, we'll be following along.
Dr. Michael Daignault, our Fox 11 medical contributor, great to see you. Thanks so much.
You.
All right.
Thanks.